Relational equity, co-creating values and a protocol for engaging patients across the Canadian Primary Care Research Network. On behalf of the Patient Council, we would like to present to you our experience. The abstract came about as the Patient Council was seeking to co-create a sense of belonging within the transition phase of the restructuring of the Pan-Canadian Patient Council. The need to incorporate values and protocols around engaging patient partners became apparent with the Council's history of engaging in the Canadian Primary Care Research Network governance amongst researchers, patient partners, and allied professionals. Relational equity is understanding and knowing about someone through repeated interactions. It is co-created and carefully cultivated so that it is preserved by those who desire to influence others. This is crucial for the retention of patient partners, community members over time, and the establishment of trust between patient partners, community members, and the Canadian Primary Care Research Network. The talking stick is used in many Indigenous cultures as an ancient and powerful communication tool that ensures the code of conduct of respect during meetings is followed. The person holding the stick, and only that person, is designated as having the right to speak, and all others must listen quietly and respectfully. The overall design was informed by the integration of community-based participatory research and transformative action research. The process of co-creating values evolved from transformative action research and utilized an Indigenous process of a talking circle, led by a Métis woman, mother, grandmother, and member of the Patient Council. The members of the talking circle included council members, members of the Canadian Primary Care Research Network Executive, and other sport entities, the Canadian Centre of Excellence for Patient and Public Participation, as well as Canadian Institute of Health Research, and also included PAN Advisory Network, which is a patient and patient partner-led group advocating for patient partner engagement. The values: respect, curiosity, humility, trust, and kindness. Values are reviewed at every council meeting. Each council meeting begins with a question related to values. The intention is to build trusting relationships and a sense of community that is culturally responsive to relational equity with the members. The facilitated co-creation of values while utilizing the strengths and contributions of the community through the lens of equity, diversity, and inclusion. Program evaluation. Following the meeting, all attendees were invited to complete a survey to evaluate the strengths and opportunities of change going forward. Many of the attendees, 84%, felt satisfied with the event and that they felt that their contributions mattered. The talking circle facilitated the members coming together in a way that addresses the power imbalances within and external to the council. The next step for the council is to undertake a strategic planning process that supports the objectives of the Canadian Primary Care Research Network, with focus being on primary care research. The council held monthly meetings to co-create values to facilitate embedding the patient partners within the governance structure of the Canadian Primary Care Research Network. This included the Executive Committee, the Steering Committee, and all other standing committees. Part of the mandate of the council was to support the funded research projects patient partners through a community of practice and it is yet to be established. Thank you on behalf of the Canadian Primary Care Research Network Patient Council.